Hi, now all of these slides that you're going to be viewing for the AMP, the Biology 2404 lab, um, are made to go along with your textbook for the lecture portion. I purposely made this lab manual so that it would correspond with the textbook so you did not have to buy an additional book. So please remember to use them together. A lot of the pictures are not in the lab manual specifically because it will tell you at the beginning of each lab exercise of which chapter it refers to in the textbook. So use the pictures there. So this first exercise is the introduction to this course. This is Anatomy and Physiology. It is a general course in which we cover everything in one semester versus the more detailed courses that often are 2 semesters. So we will cover all the systems, all 11 of them, and we'll do it all in this one semester. The lab exercises are pretty much divided into both one exercise will be for the anatomy and then a following one talking about the physiology of it. So as we get started here, the first thing you need to understand is the definitions between anatomy and physiology. Anatomy refers to the body's structure. What does it look like? Physiology is looking at basically the function. What does it do? How does it work? Why does it work the way it works? And something to keep in mind when we talk about AMP is a phrase that's heard a lot of times, and that is structure determines function. If you were ever looking at some anatomical structure in the bodies, a bone, a muscle, something like, what in the heck is this thing? Just by the structure of it can often help you realize, what does it do? Things are not just randomly thrown together. Things are put together in such a way as to make it much more efficient in the job that it has to do. We have our own vocabulary. I know this can be very frustrating at first, but we do have our own vocabulary in AMP, and it's going to be easiest for you if you learn it as soon as possible. Like I said, I know you look at this picture and you go, oh my goodness, there's so many different phrases here and terms. How am I ever going to know this? Trust me, by the end of the semester, you're going to be looking at some of this and going, oh, of course, I don't even have to think twice about it. Learn it now and it will make it so much easier later when you're looking at the bones and the muscles and the nerves, etc. An example over here is the brachium or the brachial region. That's referring to this upper arm here. Now, if you learn that as the brachial region, now, like I said, it will make it so much easier because here you've got a muscle, the biceps brachial, triceps brachial. You have the brachial nerve. You have the brachial vein, the brachial artery. So if you already know from exercise 1 that the upper arm is the brachial region, like I said, it will make it so much easier down the road. So if I ask you when we're looking at blood vessels, where's the brachial artery? Don't be looking down here in the toes because you are in the wrong spot. The directional terms, we don't use up, down, left, right, front, back. Some people may say that we're trying to aggravate you. I don't know, maybe we are. But we do use special terms. When we are referring to something being above, we say it is superior or cephalic. Usually superior is the most common one. If it's below it, it's inferior. If you're going towards the front of the body, we say it's anterior. If it's going towards the back of the body, it's posterior. Start recognizing now, see how they're paired. If you're talking about something that's going more towards, if you think of a midline right down, this imaginary line right down the middle of the body, if you're going towards that midline, it's medial. If you're going away from it, it's lateral. Now, proximal and distal are only going to be used on what we call the appendages, only on the arms and the legs. The closer you move to the point of attachment, so on the arm, the shoulder, the leg, the hip, you say that's proximal. If you're moving away from it, you say it's distal. And so these are all terms that are going to be used, as I said, as directional terms, but also for comparison. As an example, you could say, oh, the elbow is proximal to the wrist. So what are you saying? You're saying that the elbow is closer to the point of attachment, to the shoulder, than the wrist is. Once again, proximal and distal are only going to be used with the arms and the legs. There are 3 planes with the body, and it will divide the body as though you do a cut. Oftentimes this is done with CT scans, x-rays, etc., depending on, well, what the doctor's ordered is, depending on what you're trying to look for. What information are you trying to gain? And so, excuse me, the frontal plane, which is also known as the coronal plane, coronal, think crown. Where would you put the crown? Across the head this way. It will divide the body into a front and a back. The sagittal plane is as though you've cut, once again, right down the middle part of the body, dividing it into a right and a left side. And by the way, whenever, if you were to use right and left, if we use that as a description, it is always the patient's right or left, not yours. And then the transverse plane right here is going to, and this might be what a lot of you may be more familiar with, such as looking at a CT scan, is that it divides the body into an upper portion and a lower portion. The body cavities. There are several different cavities within the human body. First of all, we divide it into the dorsal body cavity and the ventral body cavity. Dorsal meaning the back portion, that it's going to be comprised of the cranial cavity where the brain is, and then the vertebral cavity, which contains the spinal cord. So these two on here, orange cavities, comprise the dorsal body cavity. The ventral cavity, ventral is typically what you think of on the front, and that is going to be composed of what is seen here is the purple, this reddish, and the green cavities. Together, this is from your sagittal side view, and then the front view or anterior view. The ventral cavity is divided or subdivided into initially 2 parts. The thoracic cavity. The thoracic cavity, as we see here on the anterior view, contains the lungs. It contains the heart. Basically, it's everything above the diaphragm, which is right here. The abdominal pelvic cavity, sometimes this is initially combined together as one, as you can see right here, the abdominal pelvic cavity, and then further divided into the 2 separate parts, the abdominal versus the pelvic. There's no like muscle or bone that distinguishes or separates these two like there is with the diaphragm right here that separates the thoracic from the abdominal pelvic. Pretty much kind of look across the hip bones and down in this area, the pelvic cavity, where the bladder is, etc. And as we study throughout the semester, the various systems and organs within them, we'll talk about the placement of them within these cavities. With your abdomen, we can divide it into quadrants. Sometimes that makes it a little bit easier when you're trying to describe to someone. Let's say you have a patient come in who's having some abdominal pain. Where is that abdominal pain? Well, it's kind of in this little general area over here. Well, sometimes you're not seeing your coworker. You're leaving notes for them. You're leaving notes for the doctor who has to make sense from it. Well, oh, it's sort of on the left upper side, about halfway down. How does that help you tell where are you talking about in here? So that's why we initially divided into these quadrants. And enjoy this because we're very nice with the names. You have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. And so at least if you can say, oh, well, the pain is in the right lower quadrant, you forget about these areas, you know to be looking down in here. It helps to narrow it down. And then we can divide even further into regions. So a region is smaller than a quadrant. There are 9 different regions. Once again, you've got over here the right hypochondriac region, epigastric region, left hypochondriac region, the right lumbar region, the umbilical region, left lumbar region, the right iliac region, hypogastric region, left iliac region. Gastric refers to stomach, and this is your stomach right here.